You asked about aspirin versus clopidogrel. Here's what really matters for your treatment. See, both medications prevent blood clots, but they work in completely different ways. So think of aspirin like a roadblock. It permanently shuts down tiny factories in your platelets that make them sticky. And once aspirin does this, those platelets can't clump together for their entire 7 to 10 day life. That's why one aspirin pill affects you for over a week. On the other hand, clopidogrel, it's like changing the locks. It permanently blocks different doors on your platelets so they can't receive the clotting signals. This actually makes platelets less sticky than aspirin alone. But here's the surprising part. Studies show clopidogrel prevents stroke and heart attacks 8.7% better than aspirin in high-risk patients. But here's the catch. It doesn't work properly in 30% of people because of their genetics. As for bleeding risks, they are a bit different. See, aspirin causes more stomach bleeding, 2.7% versus 2%, but clopidogrel causes more serious bleeding that actually requires hospital treatment. As for the time difference, aspirin starts working in 30 minutes. Clopidogrel takes 3 to 7 days to fully kick in unless you take a big first dose. So the bottom line, if you already had a heart attack or a stroke, clopidogrel is usually better. And for preventing a first heart attack, aspirin is still the go-to choice. And sometimes doctors prescribe both together for maximum protection after heart procedure, but of course, never switch between these two medications on your own.